In therapy, we talk about 70% of the therapy is about listening and empathy. Never assume or underestimate what the person in front of you is going through. From external factors, they may be looking very happy and well settled and traveling overseas and all of that, but you got no idea what they are going through. So being kind to people, everyone around us, regardless who they are, listening without judgment and empathizing with what the person is going through. Listening is the most powerful thing you can do.
Hello and welcome to another episode of Ways to Wealth. Today I'm joined by Anil. Anil, why don't you give us the two-little read about who you are and how you kind of got here and what your focus is.
Great. So first and foremost, thank you for this invitation. So my name is Anil Thapliyal. I've got a professional background in counselling, family therapy, and psychology. So it's how I got here. It's probably quite a long journey going back in time.
Yeah.
And that is when I was working in the primary care, and the people I was seeing for the first time, when you learn that they've been waiting in the queue for 18 weeks. A day is long enough when you've got mental health challenges.
Right.
Wait 18 weeks? That's not acceptable. So that's when my journey started, to look at the role of digital technologies, how it can improve timely access to care, support, and treatment.
Okay, cool. And that kind of how long ago was that when you kind of had that realization?
This is year 2000 we're talking about. So and those that I used to talk about this, people used to think digital and mental health, they don't go together. We come a long way now.
Right. Yeah, because now you start to see the adoption, start to see the use cases emerge with at least some digital interventions kind of coming to the forefront.
I think even though we've come a long way, I think we still got such a long way to go to get it right by design. So it's kind of a haphazard. It's all over the place, and some people are just too by themselves because system of care as the ministries of the world are not responding in the way to meet the needs of the consumers of the day to day.
Yeah.
So I think there is a lag between how policy and other decision makers are able to pivot and meet the needs of today's people, the consumers of mental health cases.
Do you think that nowadays do you think there's more awareness though now in general since 2000? Like, would you say what would you say what does the data say around kind of mental health issues and kind of, I guess, then acting on them, perhaps? So awareness and consequence, like from, let's say, the early 2000s to today, is it worse? Have we made progress?
Yes, we made progress to a degree. New Zealand has been at the forefront of destigmatization of mental health programs and initiatives like mine in New Zealand, which were the heydays of New Zealand being recognized as the thought leader in the world, not just New Zealand, but in the world we're talking about. So Like Mind program made waves around the world, and many countries around the world have emulated that model as to what good looks like in that particular space. Yeah. And then there have been other programs which majority of the listeners of this podcast would know were fronted by Sir John Kirwan. It was called the National Depression Initiative. So Sir John Kirwan became the coach, the mentor, and coached and guided the people throughout New Zealand through a series of television commercials where he was communicating a message of hope and his personal sort of a journey as to how he had the challenges despite being the captain of All Black team and all the glory and the fame that comes with that. But he was not immune to that. So how even a person as macho as a manly person as a All Black captain, former All Black captain, sharing his own personal journey, it's okay to seek help. Yeah, what does the help look like, and giving people permission. So I think we have done historically, going back in time, some amazing programs. I'm not too sure over the subsequent governments over the years if you have kept up with what was required to build on that. So we've fallen short of keeping up what the good look like.
Yeah.
So from being the front of the queue in terms of what good looks like around the world, I'm not too sure if that is the case as of today.
Right. Okay. And where's that primarily driven? Like, what is the driver of that kind of momentum?
So I think there's two ways. One is a consumer movement, and which is where people are more vocal, people are have got a level of awareness. There are consumer movements, and consumers are demanding uh, the services that are fit for purpose for them.
Yeah.
Right. So that is a consumer-driven movement, which I strongly believe in grassroots movement. So, but at the same time, the doing part requires fiscal sort of support from the government of the day in whatever shape and form, whether it comes from the primary care, whether it comes from the Ministry of Health or Health New Zealand. It requires a financial support.
Yeah.
And I think over the years, it has become quite disjointed. So I think what we now see is some effort. So what we call is some of these initiatives would fit under what we call is public health campaigns,
Yeah.
public health initiatives. Some of this is also happening out of the primary care environment. Some of these also being done by not-for-profit sector, and so mental health foundations of the world. So I think there are a range of avenues and channels comes from, but primarily if it has to work for the nation, it has to be driven top down by the Ministry of Health or the other central agencies which are working for all New Zealanders.
Right. What's the sort of split that you've seen in terms of, I guess, age, like where the demographic? What does the demographics say?
Well, I think mental health space nobody, so it is across whether we look at uh, youth, so mental health issues, youth, mental health and youth fronted suicide rates in New Zealand. We're talking about, we regarded as one of the highest in the OECD countries.
Yeah.
So
Why do you think that is?
range of problem, lack of some services which are geared for them at the time and place where they need it most. Some of the fit for purpose solutions, lack of those. So that's when one of the aha moment happened going back in time, and the lowdown was first launched in 2007, 3rd of December 2007 in New Zealand. The first month we had 19,000 people access the service. It was a texting-based service, 5626 is the number. And 19,000 young people texted the service to seek assistance. And some of the challenges they would put to you, life sucks. It's just two words, life sucks. Somebody would, from the lowdown call center, would respond back, this is Ministry of Health funded initiative, which still continues to this day, by the way.
Right.
So they will respond back saying, hey, John, sorry to note you're going through a pretty rough patch in your life at this point of time. Is there anything we could, would you like to talk to somebody, And Johnny, we could be going through some exam stress, or mom, dad not getting along well with each other. It could be a range of reasons. And so after the 1 month of the launch of the program, when I was invited to the parliament to talk to the minister, associate minister of health at the time, Honorable Peter Dunn at the time. So he was asked me, where were these people going before? And so I didn't have the research-based response for that, but my gut-based response to the minister at that time was, they were going nowhere.
Yeah.
So you have given them a channel to engage with some services.
Yeah.
And that's what it ended up having. So have we got fit for purpose channels for young people to engage with the services right now? So the problem lies is also awareness is increasing. people's ability to express themselves and reach out more is increasing. But the appropriate services, I think we got some brilliant solutions, but they're point solutions. So when I'm talking about solutions, I'm talking about the population health level for all young people in New Zealand.
Yeah.
So what does that look like? So you can have point solutions that are working beautifully, very well in Sabakato region, Bay of Plenty region. So, but what about for all New Zealanders? So I think we need to just look at, mental health has no geopolitical boundaries. It does not contain itself in Auckland region or Bay of Plenty. It affects all New Zealanders regardless of where they live.
Yeah. I mean, there's often a trigger, kind of a lot of what we're talking about here is also like, I guess, once the kind of straw has broken the canvas back. And how do you find the trigger points early? And like, how do you do that in the piece? Through education, through, I guess, having strong relationships with your peers and people around you to maybe notice? Because we were talking before the podcast about some of the data you had and how the kind of unknown that I think some of the most troubling data is perhaps the people that you didn't see it coming.
Yeah. So one of the stats from a recent talk I gave in a place called Maastricht in Netherlands.
Yeah.
So over there, I was talking to them about their own statistics, which would be comparable to majority of the developed world. So over there in 2023 Netherlands, 1,862 people completed suicide in that nation as a whole. Out of those, so when I asked them, how many of those were known to the Dutch healthcare system?
Yeah.
So only 40% are known to the Dutch healthcare system. So that means 40% of those numbers were made an attempt to seek some help in mental health through the traditional mental health support systems that are available in the country.
Yeah.
1,117 people, that is the rest of the 60% of the people, are not known to the Dutch healthcare system. They did not establish contact with any help seeking. So what we're talking about, if we correlate those numbers to New Zealand, more or less we're talking about similar percentages in terms of the people who did not access the help here either. And that is consistent with the UK and many other countries, Canada. So when we're talking about, if there is such a huge proportion of the society, despite the availability of the services, they're not going to access this. So where is the problem? So maybe perhaps if I'm having a challenge in my inability to repay my loan, which I borrowed from the bank as a business,
Yeah.
I do not see that anything to do with mental health.
Yeah. Right.
So if I so computing that in my mind, what I seek help for. So we design services, clinicians would design this amazing, beautiful services, which make sense to them in the context and the language. So this is what I always say. So there's no point in having services that, if it does not work for the person with the lived experience. So we are talking about the person with the mental health challenges, person with the lived experience, their families and the carers, then it does not work at all. So it's not about a solution which you can crow on about if nobody's accessing it. So,
Yeah.
so it has to work for the person with the lived experience, their families and the carers. That is a fundamental premise. Now, nothing about us without us. So you cannot develop solutions without understanding the problem statement. So what does good authentic co-design look like?
Yeah.
So what does it even look like? What does it mean in terms of when you have really, really understood the problem statement, what do the consumers want? And then you would be able to address the blind spot we're talking about. Maybe the people want something much more simplified in the way they are responded to. It's not all that bad here in New Zealand. We do have amazing solutions like the National Depression Initiative, 0800 111 757 is a number. The service still exists even today. It's a 24/7 response service. People can reach out to it. And it is, so beautifully resourced in terms of its capability and staffing and the quality of training that people receive. It's Ministry of Health or Health New Zealand funded initiative, and it's there. and there are many other resources that are available. It's just that they may not be necessarily widely known to everyone. So how they can even reach out to that
Right.
if they don't know it exists
Right.
for that particular challenge the person is having in their life.
Yeah. Yeah, that makes sense. So there's and in a moment, right, of madness or a moment, you're probably more distorted. So kind of if you have no idea beforehand, how you going to figure that out during a mental health episode, potentially anyway.
It's quite amazing that how many times a week I receive a call from somebody I know who works in the healthcare system, and their child is having some sort of a challenging time in their life, and they'll ask me, where shall I send my child or daughter to? One present happened in late last week only. So, so for me, you raise a good point. See, it doesn't matter where you are. You could be working in the healthcare system, but when it happens to you and your child is in actual distress, even your ability, cognitive ability to navigate through range of options, what is available. Fortunately, I'm just aware of this amazing program in offshore in Auckland called Youth in Transition. So I'm a big fan of Tina Jones, the founder of the initiative. Youth, probably one of the best in the country. Um, and yeah, so I was able to provide some amazing, timely sort of help.
Yeah.
But is it about people just reaching out to me, or is it shouldn't we be able to navigate that through
So
some mechanism?
it should be known as what is known as 111.
Well, I would say there there needs to be some mechanism, and that mechanism exists through a New Zealand resource called uh, 737,
Right.
which is a national 24/7 number again. If you call them, they will divert or put you in touch with not necessarily all the services which I'm mentioning, and they're known to me because this has been my lifelong commitment uh, to get it right, not only for New Zealand but also for the entire world. So,
Yeah.
so we are a global organization. So for me, uh, and the sector is also very dynamic. So it's changing, and new things are coming on all the time. So keep it updated. So there are some really great organizations like Health Navigator, Charitable Trust. So there are some dedicated organizations which you try to do their best to keep the database of activities. That's where all the doctors in New Zealand go to look for the what's latest and the best available in New Zealand. But there is amazing organizations like Changing Minds, which are based out of Auckland again, and Mount Eden. There's another great organization everyone should know of is Mental Health Foundation, Amber Innovations, which is mental health organization out of innovation-based organization in North Shore in Auckland. So there are some amazing organizations. So it's not the lack of innovation and good Samaritans in New Zealand. It's we ought to be very proud of all of us as a collective, some as a nation.
Uh-huh.
But your point earlier on, when you are in distress, your cognitive ability to go through simple information and to make sense of it for yourself or for your loved one, it can be very challenging.
Yeah.
And so this year, so our organization, which I'm the executive director of, eMHIC, the organization, we have got a think tank session happening in Toronto in November. The entire whole day is on systems navigation, precisely what you're talking about. So how do we, so it is being anchored off Australian government. This is Australian Department of Health and Aging, which is a federal health agency in Australia. Their long-term commitment to get the systems navigation for entire Australia right. But if you get it right for one country, same principles would apply here or any other country. So we work very closely with many country governments of various nations.
Yeah.
So Australian Department of Health is going to be in Toronto. They are leading that particular session for eMHIC. So the key thing here is, uh, you know, mental health is a global challenge. There are a few things we have done really well in New Zealand.
Yeah.
And we need to see that as mental health is not one thing. So you could be having large challenges around well-being. Balanced scorecard of the
Yeah.
time you spend at work and at home and exercise, maybe just a little bit out of kilter. So that's more around well-being area, just making sure you keep yourself well.
Yeah.
Bit of a meditation and just you keep yourself really healthy, mentally and physically both.
Yeah.
But then you move into the next stage, what we call is mild to moderate kind of challenges.
Mm.
So, which generally the protocol, what we would define as you go and see your GP or, uh, to get it assessed and seek. And majority of the cases, you don't need medicated treatment for that. It could be non-lifestyle changes. You might be able to also use a range of solutions, which would be online CBT based. So basically, it's about reconfiguring the way you think and conduct yourself, and basically being able to bring a little bit more elements of life which are going to be healthier for you. So those are CBT, DBT based programs, but they're online delivered. So they could be either purely self management, there is no human being at the end of it,
Yeah.
or they could be online plus there is a human being. So you choose what is your preference.
Yeah.
It's quite amazing. Some people, majority of the people, sometimes may opt for just pure self go alone.
Yeah.
But that's what they're comfortable. But there is a increasingly huge number of people who also want assurance of somebody expert or providing an oversight. So these solutions can be delivered through either the laptop or a personal device like a handphone or some device. So I think today I don't even like to call it a digital solution or digital offering, because we don't call it a digital banking, do we, anymore?
Not.
When you want to pay your plumber or Sparky, you simply transfer money through your phone through the person. You say, I'm going to send you money through digital banking. So it's the same rules should apply here. This is not about digital mental health. This is mental health.
Uh-huh.
This is mental health. It's just that we have to speak the consumer's language. So I have this beautiful metaphor. And there's a research based out of UK, which talks about the top 10 reasons, uh, not reasons, ways which we use our smartphone these days.
Yeah.
Top 10 reasons. And top 10 reasons, making a phone call has not made it to top 10 in the from
Right.
the smartphone.
That's fun.
That is number 11 activity.
Right.
Number 1 is texting.
Yeah.
So, and the list goes on, social media and the news and the banking and everything else comes before making a phone call is number 11 activity. So for me, if I look at those kind of statistics as to how consumers are behaving, and that is across the range, it's not about for young people only.
Yeah.
But across the range, age brackets. So we are talking about here is speaking the consumer's language through digital means. So if it's easier for me, we also know the prevalence or the prevalence of mental health aside, but even when these challenges happen in somebody's life, unfortunately, they do not happen just between 9 a.m. to 5 p.m. Monday to Friday. They happen when they happen. It could be 3 a.m. in the morning on Sunday morning, could be or late p.m. on Saturday night. So what is available at 1 a.m.?
Yeah.
So we need to think about the construct of when people need the intervention.
Yeah.
And what does a timely intervention look like? It may not necessarily be clinical in the way some of us as clinicians would define it. It could be sometimes the timely intervention could be just, a nudge in the right direction.
Yeah.
Just at the right time. But if at the right time there is no nudge in the right direction, it could escalate into something quite critical situation for the person, and that could end up in self-harm or, even worse. Yeah.
So you mentioned about the medication not necessarily needing to be administered in kind of, especially in the early stages. Um, is there any interesting and I was thinking about it randomly, um, not yesterday, but it wasn't about this. I was thinking about it in this context, but it's funny that I was thinking about it prior. Was that having known people that have been on medication, put on medication, do the clinicians need to, or is there any studies around, putting someone on medication when they're already substance abusers of other substances, and does that actually affect the kind of concoction of, what it's trying to help?
Yeah, that's a quite a loaded question. So,
Sorry, I don't know. I was just thinking about it yesterday. That's right. Is it something because it's something the person may not disclose even? So how would you know?
it depends on, it's just like uh, needing antibiotics, and then I'm also having my couple of gin and tonic and tonic, so I think, is that advisable to do that? Of course not.
But you can't.
Yeah,
You can't prescribe with that in mind.
yeah. You can, whether the patients will adhere to what has been told.
Yeah.
Particularly when you talk about addiction at the level which is mentioned. So whether people comply and listen to the advice that's been given. But I would like to say, because there are so many combinations,
Yeah.
so you can't just simply say absolutely no. But in most cases, I would say it will have adverse implications.
Yeah. I guess it's really hard to manage and implement. But I was thinking about it just randomly yesterday. Like, you know, how does a clinician make a decision if there are these other variables in play? But yeah, it was a random thought. I thought I'd pass it on because you were here.
I know it's a great question, because I think a lot of people may not be asking otherwise, and doing it just anyway.
Yeah.
And I think that's even putting themselves in more harm than good. So better to seek clarification from the person, like a GP or a psychiatrist or whoever, or a person you're seeking the assistance from, because they are the only people who would be prescribing those medications. In some case, nurse practitioners may also prescribe some medications in New Zealand. So I think the key thing here is about looking at, uh, first and foremost, most clinicians would want the first preferred mode is to look at non-medicated treatment options.
Yes.
When those options have been exhausted, then people prescribe medication.
And how long should that take, do you think, on average? Or how long does that on average take? Is that like 2 visits? Is that a month? Is it, because obviously it's in the context of every situation is different, right? So the event or the episode may be more extreme in different circumstances, but typically, what's that sort of time frame when you're trying to explore these non medication based?
I think it's so circumstance driven. There will need to be a totally judgment call of the clinician, to be honest, because it's very hard to say 2 weeks, 4 weeks, because this doesn't mean anything, because the person is a person and they're going through whatever challenge and anxiety or whatever they're able to cope with. A clinician is the best person to make the right call, because not everyone lives in, you know, major cities like Auckland, Wellington, Christchurch. So there are people living out there in the hardbacks with remote and rural challenges out there, and frequency of the person they are able to see may not be as frequent for some people. So I think, even though we think we're a small nation, but there are vast tracts of New Zealand We are talking about the Mandeville. We're talking about so many other areas and Gaston and so many where availability of what are described as a mental health support services could be so thin on the ground for the local people. So I think we need to be very cognizant of that when we are talking about people, that people's ability to think of what is available for them locally is so vastly different depending on where you live. But this is where the sheer uptake of the digital solutions has gone through the roof around the world.
Right.
So we have at the moment 5 million downloads per day
Yeah.
of digital solutions a day. So this is
So the people actually taking action.
the people are doing something, but the shocking thing about this is where probably it gives me a lot of challenge even thinking about it. The only 19.8% of those 5 million downloads meet the quality threshold for being safe and effective solutions.
Who determines that?
There's many international organizations do that. So there is an organization based out of UK. It's called Organization for Review of Care and Health Apps. Orca is a global organization. So there are many organizations committed to getting it right, what good accreditation looks like, what activation looks like. So they work with the government of 13 countries around the world and increasing by the day. So there are major organizations which enable what good looks like. So not all of solutions which we find online does not mean they're all good and going to be good for you.
Yeah.
So in New Zealand, fortunately, we have an organization called Healthify, and it's owned by a charity called Health Health Navigator Charitable Trust, championed by Dr. Janine Bycroft, a in my view, a living legend in New Zealand, 2023 winner of the GP of the Year for New Zealand.
Wow.
An iconic Kiwi who has done so much great work in primary care, but also in digital mental health. So their Health Navigator charitable website, Healthify, has those solutions that are good and effective. So they are there. So there is beginning of some amazing good stuff. I think what we need to do is find ways and means to support the likes of, Healthify, to become do much more at a grander scale at the national level.
Yeah.
And not remain a boutique. And while we do great things, we're not really good at telling stories either. So how many people would have known, how many of the listeners would have known about these things I'm talking about? For majority of those people, the first answer, wow. And I want them to Google, but I want to check and challenge the way we do traditionally have done things. But at the same time, I want to celebrate the people who are the real champions of what makes New Zealand such a great country to live in. So how do we celebrate? In some ways, we talk about leadership development, and we talk about all of that. But I really think we do not much when it comes to practical realities.
Okay.
We don't do much of leadership development. We don't support the people who are the cornerstone of our great society.
Yeah.
So I think so. What does a good look like? So how do we support? How do we create the movement? How do we create the awareness of some of these amazing things?
Yeah.
So solutions are there. So I don't want to paint a very negative picture.
Yeah.
Solutions are there, but are they amplified enough? Do people know about them? Do we need to do more? Absolutely, yes.
Yeah.
But let's build on the existing great initiatives that exist out there.
Yeah.
Let's support them, make them stronger. So there is an amazing initiative out of Waikato region called Just a Thought.
Okay.
And Just a Thought, and I would encourage all your listeners to Google it and check out the website. It's a digital mental health initiative for Kiwis. What a great example of what innovation looks like in improving access.
Right.
That is a solution. There's a clinician by the name of Anna Elders. She lives in Bay of Plenty in Taronga right now. But another Janine Bancroft equivalent in mental health, a great champion, deeply passionate, and she has embedded that just a thought into the so many primary care clinics. So uh, where just a thought could be prescribed for the people, but when you don't need to wait for it to be prescribed, you can go and access it on your own as well. So but the thing is, you need to be aware of it. How does it help? What problems is it been designed to address? So I think what we have is sporadic brilliance, innovation happening all over the country.
Yeah.
And what we need to do is, how do we democratize access? Well, so the people can only access if they know about it, that it exists.
Yeah.
If they don't know, then there is some, mental health is all about communication. We need to get better at communication ourselves in terms of letting people know about these things. And
And is there also a kind of a dynamic of people not thinking that they are like almost, oh, well, it's not bad enough yet, or something like that? Kind of when consumers are thinking about, is my mental health issue bad enough? Does it warrant talking up? Is that something that goes through the minds of the individuals at the point in time, or is it that embarrassment? Is that, oh, I don't want to admit that that's going on, or you know like, kind of, I go to the doctor. I don't want to go to the doctor because I just got a headache and it'll be fine in the situation. Similar. Is there a similar dynamic going on?
yeah, and I think it's more to do with how, as a society, we've been sort of conditioned in the way we carry ourselves in all walks of life.
Yeah.
And how readily we share our emotions, what's going on for us.
Yeah.
So the genesis of the development of the National Depression Initiative, which was fronted by Sir John Kirwan, was precisely that. At that time, 76% of the time, when we were developing that initiative for the country in New Zealand, 76% of the completed suicide at that time in New Zealand were men.
Yeah.
All right. So the Ministry of Health's aim and objective was to encourage more men to seek help.
Right.
That was the reason. So what ministry is thinking at the time was to look at, how do we get a male role model, and male role model who enjoys the trust of New Zealand.
Yeah.
And is a person with the lived experience themselves.
Yeah.
So it's not an actor, or you're not reading a script. And so I must say that I have a huge respect for Sir John Kirwan, for that matter. So he volunteered to be that voice in the face for all New Zealanders. And because he enjoys the trust, and he also did not want it to be a commercial arrangement where he was charging for filming, because he used to live in Japan in those days as a Japanese rugby team coach. They used to come here and do the film on Rhyme. So basically, his presence alone, and on the television commercials, the radio and social media channels and other means, lifted the engagement of men into mental health services from 27% to 41%.
Right. No, that's
So awareness and kind of programs that are tailored, how you design them. So at that time, I remember Royal New Zealand College's GPs awarded Sir John Kirwan a medal they give it only to doctors, which is my GPs. That was the first time they gave it to a non-GP, the medal, which is highest honor the Royal Legal College of GPs gives. They gave it because all over the country in those days, people were coming and talking to the GP for the first time about the challenge in a traditional sense as a mental health challenge, but also challenge which was not traditional mental health. It could be around conflict in life and other things. So, so, GPs at the time coined the term JK effect. So JK effect was because every person who was coming along, I'm talking to you about because JK warned me to.
Yeah.
All right. So JK gave the permission for me to go. I open up and talk about it, and it was okay. And I was happy to seek help. So for JK effect alone, he got rewarded with the medal. And a few years after that, 4 years after that, uh, Queen Elizabeth recognized him in the New Year's honors as knighted with knighthood, and he became from John Kirwan to Sir John Kirwan after that for his services to mental health. So I think what matters is authenticity. Here is the key.
Yeah.
So Sir John Kirwan's authenticity. He is such an not only articulate, but he's such a genuine person. When he communicated his personal story and the way he communicates that message, you just feel you are with him.
Yeah.
And I can tell you, having known him for some time, his message is 100% authentic. So, and that matters because people can see through what is a scripted thing
Totally.
and what is genuine message.
Yeah.
And that's why the campaign worked, and that's why we were number one at the time. We just let go of that momentum at some point of time. But again, so yes, it does work in terms of why people would access sometimes services or not access things, and some of those elements from a public health messaging point of view have dropped off, and just like anything else, and
Might need a refresh cycle of a new influencer or a few new influencers that consumers.
it does work. Well, absolutely, it does work, and influencer who people can relate to in today's day and age. Majority of the people, young people, were not even probably born when Sir George Cole was playing for all that.
Totally.
So.
Yeah. So what with the work you're doing, I know it's global, but I think you seem to have you seem to have a very international vision. However, you seem to always come back to New Zealand in terms of the application, I guess, because it's closer to your heart, perhaps. What does success look like over the next 5 years in your endeavors to basically help people get better access to ultimately better mental health services?
So the point you make about the global role, yes, our role is very global. So just to put that in context, what does the global mean?
Yeah.
So 90% of our work is overseas.
Right.
And that includes countries ranging from Sweden, Denmark, Netherlands, England, Scotland, Ireland, Wales, Canada, United States, Australia, of course, New Zealand. I live here. Singapore, Philippines, and the list is now going on to include Sri Lanka, India, Qatar, United Arab Emirates, Indonesia, and the list is growing. Mexico as well. So traditionally, in the good old days of our heydays of when we were doing these amazing, cool things in digital methods like the lowdown, or referring to, and many other things. In those days, digital mental health was kind of by default associated with the developed nations.
Right.
Today, digital mental health is everywhere. It's everyone's conversation. And in some ways, I'm surprised as to the sophistication of the digital mental tools in developing countries is far more superior than the developed nations. They have leapfrogged.
Right.
Right? So we are still doing a very linear way of development.
Yeah.
And A leads to B and B leads to C. And over there, the ABC is missing. They just gone to D.
Yeah.
So there is an advantage some of those nations have. We don't want to be left behind. We've got amazing the can-do attitude that roll up our sleeves and get on with it and just do it.
I like
So so it's so for me, New Zealand is where my heart is. This is where my home is. This is where my family lives, and I think there is something to be said for when I come back to New Zealand. So out of the 12 months of the year, 9 months I'm overseas, traveling to member countries, and 3 months I'm in New Zealand. So when I do come back every time, doesn't matter which part of the world I come back more, it's just like sense of peace. I'm home.
Okay.
And so, but at the same time, I also believe that one word, one family, one future.
Okay.
So I think we have to subscribe to that because you, regardless of which family member or all the listeners, they will probably all of them have a relative either who lives in Australia or in the US or back in UK or wherever the countries your listeners come from.
Uh-huh.
But the thing is, we cannot contain that it is just not our problem because across the ditch or. We have to worry. We have to act as a global. We are part of the global equation now.
Yeah.
And so 1 + 1 = 11, not two. So what does the 11 look like? What does the high impact outcome look like? And this is what we are working with. So apart from the countries I mentioned we work with, we also help the United Nations with the humanitarian crisis with 300 million people around the world. So that is working with a Deputy Secretary General of the United Nations. So we sit on the governing committee for that project in humanitarian crisis. We also are the people who are helping UNICEF deploy some of the digital mental solutions for low to middle income resource settings. So which is Eastern Europe, Africa. We're talking about a range of countries there, and also we work with World Health Organization very closely. So it's no more just a matter of just countries. It's about the bodies which have got. The demand is increasing so huge. It's massive, but the number of clinicians is minuscule. So just to give an example, uh, some countries, we're talking about a country of Sierra Leone, has got one mental health clinician, only one, entire country.
Yeah.
Country like Bangladesh, which is got 172 million people in it, only 400 psychiatrists, only 400. All right. So we're talking about when some of these decision makers from all countries, and not only the developing, all countries, they say, even if you double the budget, we will still not touch the surface.
Yeah.
It is that, scale of demand is not congruent with the number of workforce that is available. So physically doubling doubling the workforce or tripling the workforce, the response. Of course, we need to, we're never talking about replacement of the physical workforce because that is got a wonderful and a critical role to play. What we're talking about is we need to create a complementary conduit between the two. There is a time for physical, but let's use that to what we call the physical workforce needs to be used for top of scope of their training, right? And there's so many other things where digital can complement what the in-person services deliver. At the moment, in absence of any of that, people are just going to the Google anyway, doing it anyway. And which is not necessarily helping anyone. Yeah. In some cases, it is doing harm as well. So I think in terms of the kind of global arena, it's we know what good looks like. So there is a institute called Center for Digital Psychiatry in Denmark. It is one of the world's best national system. What Center for Digital Psychiatry looks like. Now, if we have to do that in New Zealand, so for example, an idea like that, Center for Digital Psychiatry for the entire country, for example, of New Zealand, do we need to reinvent the wheel, or can we partner with the government of Denmark and adapt it for New Zealand? So what we call is a global. This is a term introduced to me by the government of Sweden. So they are global plus local. So adaptation for the local environment of the global solution is called, they call it local. Okay. So I love that the refreshing way of thinking as to how we can create more globalized initiatives and bring them here, but they are equally sort of enchanted with the Kiwi innovation. So some of our solutions would be adapted for their nations. So what we call is this initiative and our organization is called Brag and Steal. So that means one country can brag, other country can steal the idea. The government to government knowledge exchange program. And this is, so there are so many things. Australians are really good at digital mental health standards and systems navigation. They'll be the two areas, they'll be the world's best leaders in there. So, and hey, so some of our best work is happening in Australia. So why can't we just collaborate? It's just proximity. But by the end of the day, it is not about digital. It is more about people, more about trust. So some of the best work that is we are spawning around the world, whether it be the United Nations or Canada, but which is leading in absolutely digital mental health strategy, digital mental health accreditation and activation.
Yeah.
So we don't need to do everything from ground up ourselves. It's a very expensive undertaking for any nation.
Yeah.
But it's easy for us to collaborate and say, this is where we say, what does authentic value-based collaboration look like? And this is what we need to sort of get to understand what that means and how we can benefit New Zealand more so for because New Zealand is already an integral part of this global movement. So it's not as if we are sitting outside the fence. We are inside the fence.
Yeah.
What we need to understand is um, it's not just about digital and whether we own or whether it's locally developed or not. It's more about so this question gets asked of me very often: what works at scale and what are the drivers of the success in those countries? So an answer, surprisingly, is not about money. And we have done an analysis of these nations where it's working beautiful and at scale. One of the province of Newfoundland and Labrador, which is the easternmost province of Canada.
Yeah.
And so when we look at those sort of brilliant exemplars of what best practice looks like in this area, where things have been transformed radically, it's all about leadership, having a strong vision, taking risk, just waiting for some other country to do it first, and then we're going to trial it. There is a generation missing who's not accessing anything in the meantime. Right. And this is not even risk. This is more about leadership and visions. And are we determined to make sure that future generations of New Zealanders have a right support at the right point in time of the challenge before it becomes a crisis for them.
And so kind of with that in mind, then before it becomes a crisis too, then what are some actionable things that the audience could take into their minds of ways to, because I think a lot of mental health issues come from a sense of being out of control and some perhaps. What's some really kind of low hanging fruit hack, I guess, where someone can keep the wolves at bay in a sense, even if it's for a moment.
Good question, a very powerful question, to be honest. And in therapy, we talk about 70% of the therapy is about listening and empathy. So if I can listen to you, not just hear you, but actually listen to what you said to me. So I think another message before I complete the sentence is never assume or underestimate what the person in front of you is going through. You got no idea what they're going through. They may be driving a beautiful car from external factors. They may be looking very happy and well settled and traveling overseas and all of that.
Yeah.
But you got no idea what they are going through.
Yeah.
So being kind to people, everyone around us, regardless who they are and what your perception of them, be kind is one thing. Listening is the most powerful thing you can do. Just being there for the person. Or listening. No judgment, no solutions, just listening. Listening without judgment. And empathizing with what the person's going through.
Yeah.
They could be going through a relationship breakup. They could probably just lost a job. Or could be range of things. Your workplace stress because you're working in a very intense corporate cultural environment, But just listening to that person, being there in that moment without any judgment, without any solutions, just letting them say what they have to say, hearing them out, and empathizing with their situation is the most powerful thing you can do in that moment.
Yeah.
Beyond that, I think you sometimes need a mechanism where you have somebody more skilled and probably is trained for that kind of help. So some free help, which most Kiwis have in New Zealand, is the initiative which I talked about, the National Depression Initiative.
Yeah.
0800 111 757 is the number. It takes you to Ministry of Health funded initiative, and trained people behind it, highly competent, and it's a service that is available free to all Kiwis, regardless of what age bracket they are. The Lowdown is another service which is which is developed and available for all young Kiwis. Yeah. And it is can be accessed via a text number called 5626. Yeah. You just simply text. It does not even cost you anything. They even have a website. They're brilliant resources. So, and there's another 4-digit number you can either text or phone. It's called 737. It's not a 4-digit, 3-digit. And so there are range of options which you can access, and all of these solutions are 24/7, because as I said, mental health challenges and challenges in your life will not happen between Monday to Friday, 9 to 5. They happen when they happen, and you need to be able to call and talk to somebody at that point. And is fundamentally very important. But there are many other solutions. I'd be more than happy to provide some of those inspiration to you, which you can, make available to your listeners. Yeah. But I think doing nothing is not an option. My approach always has been, stop talking about the problem. What are we going to do about the problem? While you and I have been talking about this in this podcast, many Kiwis out there have been wanting to access something which they do not know where to access them from. So let's make it easier for them.
Totally. Awesome. Well, thank you so much for coming on the podcast. I really appreciate it. And I feel like I've learned a lot. So thank you so much, Neil.
Thank you. It's my pleasure.